This is Dr. Holmes Schneider at the Ozark Chiropractic coming to you again this week with our latest video. I was talking with the girls this morning trying to get some ideas. It's always the biggest challenge I have is coming with ideas to talk about things. And ask them, and Anna says, well, how about joint pain? I go, well, what about joint pain? She says, well, we see a lot of people who have joint pains, knee problems, shoulder problems, ankles, elbows, hands, feet, wrists, etc. And this time of year, it's cold out, the changing weather, a lot of rain, a lot of fronts come through, people feel a lot of the joint pain. So I said, okay, sure, let's talk about joint pain. So first off, I always want patients to realize that we do treat a lot of joint pains. I have taken hundreds of hours in postgraduate courses in extremity adjusting, treating people with ankle or foot problems, plantar fasciitis, heel spurs, that kind of thing, knee pain and such, hip pain, shoulder pain, elbows, hands, wrists, and even TMJ. So we're very well trained in how to take care of these things. And one thing I always want to stress to patients, if I ever come across something after we're treating it and we see you're not responding, we're going to refer you out to the right person if you need more care and get you taken care of from there. So always understand that and rest assured, we always have your best interest at heart. But let's talk about some common problems there we see. People always ask me too, does the weather, does that affect the joints? Does that cause pain? Because they feel it. It's not in your imagination. Yes, it does. It's the barometric pressure, the rise and the fall, that affects the joint capsules that surround our joints. So that pressure rises and falls, and that can increase swelling and inflammation that you may feel in the joints. So no, you're not going crazy, losing your mind, thinking that the weather causes aches and pains. It does affect people. I think there are better indicators sometimes of the weather forecast than the guys on TV. So what do we do with some of the joint pains and things? I always like to start out, obviously, if it's a new injury, an acute injury, you injure something, ice it first. Always remember to ice it first. For the first 2 to 3 days, you use ice. 20 minutes on, off for an hour, and you can do this off and on throughout the day on the area there. Once a problem has been there, especially if it's a chronic problem, something you've had for years, you can use heat. Now, some people still like to use ice, and you can. That's fine. Also, you can use the heat. You can use a heating pad. And remember, when using heating pads, you do not want to lay on top of them. You do not want to sleep on them, especially in backs, things. We're not talking about that, but avoid that. But you want to use it for 25, 30 minutes, and that gives a nice increase in circulation. The heat, the warmth feels good, so that's always fine too. So you can use heat there. Keeping range of motion in the joints is a very important thing. We want to keep mobility in the joints. So that's one thing I always stress to patients is going through ranges of motion exercises. If it's a shoulder, there's an exercise we call the pendulum swing, where you'll support yourself, you let the arm dangle, and you go each way, back and forth, back, forth, back, forth. Just keep a motion in the joint. Or the wall walking, where we put the arm out to the side, let the fingers walk up the wall. And always do both arms when you're exercising, or both sides of the joints, okay, we should say. For knees, just sitting in the chair and just going back and forth with the leg going up and down like this, just keeping it motion, keeping it mobile. For your ankles, just pointing the toes down, up, in, out. Just keeping motion in the joints is always very important to do when you're just sitting around. It keeps those joints from stiffening up. There's a lot of techniques we can use for adjusting that help with that, and that's something we just have to evaluate and see where you're at. But there's a lot of options you can do. I like bands and things as you get strengthening and you get stronger. You can use the various bands for resistance, for shoulder exercises, knees, hips. All joints can use them, so they're very effective. These things we carry, but also you can get them in the stores now, and so it's easier just to do that. That's a great way to help build strength up there. And those are programs we can go with you, tailor-made to what you're doing. You can talk to me specifically, and we'll go from there. But if you do have problems, that's something to bring forward to me. Don't think that, hey, we can treat backs, because everything's connected. The hip bone connected to the knee bone, connected to the ankle bones. The song goes. It's all true. So what affects things down here affects things above here, and vice versa. So we want to make sure that everything's working well, because it is all connected, and we want your body to be the best that it can be. We want you to enjoy good health, have good quality of life, independence, maintain your ability to do what's important to you. So if you have any questions, always give me a call. Please do not hesitate to call us. We can be reached at 479-667-5053. Check out the website, ozarkchiropractic.com. Look at Facebook. Give me suggestions. I'm always looking for things to talk about. But until next time, I want to thank you all and have a great day.